Hello, my name is Geraldine Date. I'm a licensed clinical social worker at UC Irvine Health. I have been a part of the interdisciplinary team in the Senior Health Center for the past 14 years. I thank you for this opportunity to introduce long-term care options. A range of living options are available, and some of those will be discussed here. People today are living longer. Researchers have indicated that longevity can be credited by better nutrition, medical advances in technology, and better living conditions. Let's briefly discuss terms. Long-term care. According to the U.S. Administration on Aging, it is a range of services and supports you may need to meet your personal care needs. Adding that, most long-term care is not medical care, but assistance with the basic personal tasks of everyday life. In your clinical practice, you may identify these as one's activities of daily living. IADL's instrumental activities of daily living, such as housekeeping, medication management, financial management, and even caring for your pets, will require assessment to help families and patients navigate housing options. Housing can be a sensitive topic for those advancing in age. Their life space is often associated with their independence. In every case, I found that one's health, as well as their finances, influences a person's living situation. The assumption I'm often presented with sounds something like, "My dad has Medicare. We need to move him because he needs help." In this scenario, there is a clear opportunity to educate this family member. Medicare does not pay for long-term care. Medicare stopped paying for long-term care coverage in 1969. And then 3 years later, in 1972, Medicaid began including the cost of long-term care in their formulary. Let's note the difference here. Medicare is an age-based program, and I often describe Medicaid to my patients as a need-based program. Unless your patient has a long-term care policy, housing options are not covered by Medicare or any other health insurance. This is why one's finances will have direct influence on one's living arrangement. The good news in this scenario is that you will have the chance to assess what his needs are. Understanding your patient's functional status will help navigate the conversation you will have regarding their life space. The tip I would offer any clinician is to infuse the concept of safety and quality of life during the conversations you hold regarding housing options. Doing so will lessen some of the anxiety and help facilitate a more fluid discussion about why your patient should consider moving. The continuum of housing or life space options include community-based care, also called supportive care, independent living, assisted living, board and care, Ccrcs, called continuing care retirement community, and skilled nursing. Community-based care is a really important resource. This option will allow the patient to stay in his or her home as long as their needs are stable and safety is maintained. Clinicians can partner with home health companies to offer intermittent nursing or physical therapy services so that, again, safety can be maintained in the home. Do note, home health is covered by Medicare. Home care is not. Home care is non-medical care, and it is not covered by insurance. Home care is offered for companionship, caregiving, and supervision. Another community-based model is the adult day care program, which works like any daycare. They provide meals, activities, and supervision. And most importantly, adult day centers can offer respite for the caregiver This model may be covered by Medicaid. Independent living is generally exclusively for aging adults. They are called retirement communities or retirement homes, senior apartments, or senior housing. Generally, they do not have congregate meals. There may be a nice clubhouse and some activities provided. And the physician does not need to provide documentation for independent living. Next is assisted living, and this may require a clinician's order for admission. Assisted living facilities provide apartment-style living with option for congregate meals. There is a menu for fee-for-services such as housekeeping and medication management that is offered. Next is a more quaint housing option called board and care living. Board and care is in the residential care spectrum, and unlike the assisted living facilities, are located in traditional single-family homes. They typically have about 1 to 6 residents in private or shared rooms. Continuing Care Retirement Community, CCRC. The CCRC is a wonderful option for those who can afford it. As one's needs change, they can graduate into whatever level of care is offered on the campus. So the CCRC, again, although a bit pricey, is a wonderful option. The skilled nursing facility requires a clinical need and is meant for really acute needs. Some may convert to long-term stay in the skilled nursing facility, but long-term care as a business is trending for less long-term stay admissions. I encourage you to partner with your patient by asking what their life space looks like to them. Have an open dialogue by infusing the concepts of safety and quality of life in your conversations. Thank you.